Hi. Okay, we're going to look at the prostate gland. Prostate. It's one of those structures that most people have heard of. Okay, it's part of the male reproductive system, and we know that it causes a whole bunch of problems, but often we're not entirely sure of what it does, where it is, do we need it, can we get rid of it? So we're going to look at that sort of anatomy. We'll start broad and we'll go in deep, you know. Where is it and what does it do? What is its general structure? What does it produce? And then we'll also look at its blood supply, venous drainage, lymphatic drainage, innervation and that sort of thing. All right? Prostate gland. Prostate. Okay, gland, that gives us a clue then. So it's a tissue with secretory cells that produce something that get excreted somewhere. The prostate gland is way down here, deep in the pelvis. It's sat on the muscular pelvic floor, and it's right up against the rectum, which is posterior to it, which you may be aware of because one method of assessing the size and consistency of the prostate is by placing a finger into the rectum, because then you can palpate very easily the prostate gland. If it's part of the male reproductive system, right, the male reproductive system then, its job is to produce spermatozoa, put them into the female environment so they can meet the egg, the ovum, fertilize that and produce a new genetic individual, right? So the glands then, we have the prostate gland and we have seminal vesicles, they produce supportive solutions that increase the probability of success of fertilization. So they produce things that support the spermatozoa. They produce a whole bunch of things, which would be another 20-30 minute talk on its own. But suffice to say that the prostatic secretions increase the survival chances of the spermatozoa in the female environment. For example, they produce an alkaline solution. The female environment is acidic, so they buffer that acidity to help the spermatozoa survive longer in a neutral pH. But there are many, many more things as well. Anyway, anatomy. Okay, I'm going to remove the abdominal contents so that we can then see down into the pelvis. And what we can see here is the bladder. Here's the sigmoid colon and the rectum is going down there. So this is a male pelvis. And if I take part of the bladder out, ooh, now we can see there's the prostate there. So this is the pubis bone that you can palpate anteriorly. The bladder then, we've taken away half of the bladder, and straight away we see the prostate. So this tube leaving the bladder there, that'll be the urethra. So the prostate then is inferior to the bladder. The urethra is going through it, so that's going to carry urine from the bladder to the outside via the penis. And this is the muscle then of the pelvic floor that we can kind of just about see down there, supporting all of this. And the rectum then is there, so that's all we've got, is bladder and then rectum. Okay, we can look at the structures of the male pelvis if we cut a section through here and look at it from the side. Okay then, this is what I mean. We're now looking at it from the side. So here's the bladder here, here's the rectum, so there's the prostate there. We classically describe it as the shape and size of a walnut, roughly, or a chestnut in some places. And it's directly inferior to the bladder, anterior to the rectum. You see what I mean about being able to palpate it through the rectum. And it's posterior to the pubis bone here. And this muscular sheet, this is the pelvic floor, the levator ani muscle group, which is supporting all of this. Now, the prostate it's a little bit special. It's glandular, but it's also fibromuscular. There are lots of smooth muscle cells in there that can squeeze. Other glands can do this as well, but the prostate is quite well adapted to this. And then if I take this off, we can see we've got the urethra, as we saw before, running from the bladder inferiorly, and then it'll run out through here. If I split this, whoop, there's the urethra there. So there's the prostate gland. Now you can see we've actually got another tube running through it here. This is cut not on a perfect mid-sagittal section, but a kind of a curving, glancing cut. And we actually have two of these, and these are the ejaculatory ducts. So there are two ejaculatory ducts entering from either side. And essentially, these are the last parts of the ductus deferens, or the vas deferens. Put this back on. Here's the ductus deferens here, running around the bladder. This is the ureter. So they'll run around the bladder there, and they'll empty into the urethra here. So the job of the ductus deferens is to carry spermatozoa from the testes to the urethra. When the ductus deferens, also known as the vas deferens, meets the duct of the seminal vesicles, these other glands back here posterior to the bladder, it then gets called the ejaculatory duct. So there are two ejaculatory ducts coming in at an angle on either side through the prostate gland to pass into, to drain into the urethra within the prostate gland. So there's some significant function going on here. So the prostate gland here, it is a collection of glandular cells producing those prostatic secretions and epithelial-lined ducts. And there are 20 to 30 ducts that drain those secretions into the urethra. Of course, this all happens during ejaculation. So the spermatozoa come around here in this muscular tube, the ductus deferens that becomes the ejaculatory duct, and then the prostate gland, its smooth muscle fibers, its muscular components, squeezes and helps propel the prostatic secretions into the urethra, and then the spermatozoa and all those fluids further along and out through the penis. So that's its function. It's those glandular cells and epithelial cells that are most likely to be responsive for cancers that form. And we'll talk about that in a moment, because prostate cancer and benign prostatic hyperplasia, that is a benign growth, they're two different things, and we'll come back to that. But we have glandular cells, epithelial-lined ducts, and smooth muscle that can squeeze. And note again how the prostate pushes right up into the bladder there, because this anatomy is important. The blood supply to the prostate gland, like other organs in the pelvis, is through the internal iliac artery. So we have the common iliac artery is the final branch from the aorta. Here we can see that, the common iliac artery, and then it's dividing into two. The external iliac artery is going to continue on down to the lower limb and become the femoral artery, whereas the internal iliac artery is diving in here, diving into the pelvis. And it'll give off an anterior trunk, which goes to these pelvic structures, and a posterior trunk, which goes to the gluteal structures. And the anterior trunk is going to give off a number of branches. And the branches that will get to the prostate gland will be the inferior vesical artery, one on either side, so arteries. Vesical refers to the bladder, so the inferior vesical arteries are branches that are going to supply blood to the inferior parts of the bladder, so also to the prostate gland. The rectum has a number of blood vessels, so the middle rectal arteries will also send some branches to the prostate gland. And the internal pudendal artery, which is a branch of the internal iliac artery but finds its way out of the pelvis and takes a very interesting route to get to where it's got to get to, that can also send blood vessels to the prostate gland. The venous drainage is essentially the same in reverse, except we see in the pelvis, we see a plexus. We see lots of veins all joined up, so like a web work of veins draining blood from all of the viscera, but yeah, draining that blood to the internal iliac vein, common iliac vein, and then inferior vena cava. The sacral vertebrae are back here, and the lumbar vertebrae up here. So blood from the prostate can also get to the internal vertebral plexuses back here. You can see how we're getting into quite a small space here. So the back, the vertebrae, are not very far away from the visceral organs, not very far away from the front really either. We looked at the lymphatic drainage of the pelvis the other week, and we find collections of lymph nodes. That is, lymph is fluid drained from the tissues of the body that collects in those tissues. It's normal. It leaks from capillaries. It's normal for tissue function. This is something that needs to happen. But that fluid needs to be collected by the lymphatic vessels, and that lymph then passes through lymph nodes, which are like little webwork masses of cells with largely immune cells in there, so they're monitoring the contents of the lymph to see if the immune system needs to react to that. And in these lymph nodes, this is where cancer cells, if they spread, are most likely to get stuck and then can start making more growths. So we find lymph nodes around the external iliac vessels, internal iliac vessels, common iliac vessels, and then back to the lumbar region. So we have external iliac lymph nodes, internal iliac lymph nodes, and then this being the sacrum back here, we also have some sacral lymph nodes. And the prostate gland can actually drain its fluids to all of those lymph nodes. They will then typically work their way back to the internal iliac lymph nodes, common iliac lymph nodes, and then they get back to the lymph nodes in the lumbar region, so paralumbar, para-aortic lymph nodes, and then onwards from there. So it's not that the prostate gland will drain lymph to its nearest lymph nodes. It can drain lymph from different regions of itself to different groups of lymph nodes. So we have to be aware of that if there is a prostatic cancer here and we're wondering if it's spread to any of those. What about innervation then? Well, this is fun. I said there's smooth muscle here. So that smooth muscle will be innervated, and we see sympathetic and parasympathetic nerve fibers running to the prostate gland. Now, sympathetic, that is fun. Sympathetic fibers, they come from the spinal cord in largely the thoracic levels. So the sympathetic nerves that are going to get down here come from the T12 and L1 and maybe lower parts of the spinal cord. They pass into the sympathetic trunk, descend down here, and somehow make their way here through splanchnic nerves, which tend to be nerves running through the abdomen and pelvis, made up of autonomic nerves, through the hypogastric plexus, through the pelvic plexus. So these plexuses are arranged around various structures in the pelvis. So the sympathetic nerves take this route all the way down to the prostate gland, because it's quite a long way away from the thorax, and the sympathetic nerves will take part, or they will trigger smooth muscle during ejaculation. They will, one, cause the prostate gland smooth muscle to contract, so the glandular secretions stored inside the prostate get squeezed into the urethra through those 15, 20, 30 little tiny ducts, however many there might be. Two, the sympathetic nerves cause the internal urethral sphincter in the bladder here, around the urethra, to contract, so that fluids can only pass that way through the urethra and out through the penis and not back up to the bladder. And three, the sympathetic nerve fibers will also innervate part of the ductus deferens. And the ductus deferens is a muscular tube. So during ejaculation, there's a wave of peristalsis that pushes fluids along that tube into the urethra and out through the penis. So the sympathetic nervous system has a big role to play here. The parasympathetic nervous system, not entirely sure. It's here, it's passing through at least. What the role of the parasympathetic nervous system, the other part of the autonomic nervous system that drives smooth muscle, that causes contractions of things, it's not entirely clear what it does at the prostate gland. Some of those fibers do pass through. So the parasympathetic fibers are coming from the S2, S3 and S4 levels of the spinal cord. So way down here. And they're passing again through the hypogastric plexus, the pelvic plexus, to get to this region here. But many of those fibers seem to be passing through to the penis. And that makes more sense because we know that the parasympathetic fibers are involved in erection of the erectile tissues of the penis. There's a change in blood flow there, so the erectile tissues fill with blood. So that's the innervation of the prostate gland. What about the parts of the prostate gland? We used to describe them by lobes and lobules. We tend to describe them by zones nowadays. And it's if you simplify it, it's not too bad. The transition zone is the region of the prostate around the urethra, largely speaking. The central zone is the region of the prostate around the two ejaculatory ducts, largely speaking. And then the peripheral zone is the prostate gland around all of that. And the peripheral zone is probably the largest zone. This is where most of the glandular tissue is, and most of the peripheral zone is posterior, up against the rectum. So it's that posterior part of the peripheral zone in which we're most likely to see the formation of prostate cancers, which means that they can be palpated most effectively per rectum. Awkwardly, the base of the prostate gland, it's kind of the flat bit up against the bladder, and the apex of the prostate gland is the inferior most part, supported by the levator ani muscle group. Base and apex. Okay, prostate cancer versus benign prostatic hyperplasia then. The prostate gland is so likely to enlarge later in life that you might almost consider it normal. An anatomist's view of normal is maybe different from everybody else's. Okay, an anatomist, when we look inside the body and we look at the organisation of the structures, you could lay these things out in multiple different ways. The most common arrangement is what we call normal. But there are other forms of normal. There are other ways you might arrange blood vessels and nerves and they still work just fine. So that's normal for all intents and purposes. It's just less usual. Do you see what I mean? Anyway, it's that transition zone around the urethra that seems to enlarge later in life for whatever reason, changing in hormones or whatever, or it seems to just grow. Now it's called benign prostatic hyperplasia because hyperplasia means it's getting bigger. Prostatic, well, we're talking about the prostate gland. Benign means that it's not going to spread. It's not a problem. It's just, well, it is a problem, but it's not particularly dangerous. So it's incredibly common. I think you're more likely to have it than not as you get older. And of course, we've been looking at the anatomy here, and the anatomy is really important. It's surrounding the urethra. So clearly, if the prostate gland, and there's not a lot of space for the prostate gland to grow into, is there? So if that tissue grows, then the space for the urethra is going to get smaller. So that's going to have an effect. So benign prostatic hyperplasia has an effect on urine flow. You know, that's one reason. But because it's right up against the bladder, and more importantly, it's right up against this internal urethral sphincter. If we get growth and we get the prostate gland pushing onto that internal urethral sphincter and compressing the urethra, then we start to get the symptoms that we associate with a large prostate in later life. The feeling that you need to go for a wee more often than you do, because it's pushing on the internal urethral sphincter. All of the stretch receptors in here, they're set up to detect when the bladder's full, which signals that you need to go for a wee, right? Difficulty in starting the urine stream, a feeling that you never really fully empty the bladder, and things like that. Nocturia, you know, this has an effect then of getting up in the night for a wee because it feels like your bladder's full when it's not. So do you see the anatomy relates to all of those symptoms? Because of the urethra and the pushing against the sphincter, if the prostate enlarges, that's pretty much the only direction it's going to go in, particularly if it's that region surrounding the urethra. So it's going to affect those other things and cause those other problems. And when the prostate gland is making you get up every night more than once and interrupting your sleep, it becomes a big problem. That's not just a little annoyance anymore. Mucking up your sleep has a big effect on your life. So it's something that, you know, you'd like to take care of. Now, if you have benign prostatic hyperplasia, if you have an enlarged prostate gland through this benign cause, it doesn't increase your risk of developing prostate cancer, as far as we understand it right now. Prostate cancer is different. Prostate cancer is when, like other cells in the body, if a cell enters uncontrolled proliferation, that cell just keeps dividing, and its daughter cells keep dividing and forms a mass. And the cancer is a cell. Cancers are more likely to leave the prostate gland and invade other structures and spread around the body, and that is very, very dangerous. So prostate cancer then can give the same or similar symptoms as benign prostatic hyperplasia. However, if there's blood in the urine or in the semen, then that is a sign that the walls of those tubes have been eroded and blood vessels have been eroded, right? That anatomy we were talking about has been broken down. That would be caused by prostate cancer. So those are really, really alarming signs. Anyway, there we go. Not finishing on a happy note, but an important note. The prostate gland, its structure, we talked about its zones, and we've talked about the cells and the tubes running through it and how it works. And we've looked at the blood supply, the venous drainage, the lymphatic drainage, and we've talked briefly about its innervation and some of the clinical conditions for which it is most well known. How can you take care of your prostate gland? If I say exercise, you guys are just going to dump on me and say, you always say exercise. I do, but exercise is a known thing to help against cancers. Anyway, it's not like a muscle you can train. It's one of those things. Okay, look after your prostate gland if you're 50% of the people that have one, and I'll see you next week.